Yay.
You go. All right. So, for those who don't know us, I'm Dr. Haley Hellstern, and with me is Dr. Marissa Quattrone. We're both pediatricians in the Pittsburgh area and part of a larger network of pediatricians with Zest Pediatrics, which is a direct primary care pediatric network. So we do things a little differently in that we're not insurance-based, we're membership-based. So we are able to spend more time with our patients, like hours if needed. And all of our families have 24/7 access to us via text, phone call, email, that sort of thing. So we do a lot of one-on-one care with our families, and we absolutely love it. And we are doing monthly sessions called little Zest sessions, going over kind of some hot topics in pediatrics and parenting to help you all along the way. And for those who aren't able to make it live today, we'll be sending out an email with the link to this recording. We're recording now, that will be accessible for the next week. So let us know if you have any questions. And with that, we will get started.
Oh, how cute.
Can't really maybe. All right. So today, sorry, it's a Canva baby. I don't even know whose it was, but I all right, so we will go over the supplies needed and when to start feeding and how to start, kind of the different techniques with purees and baby-led weaning. We'll go over allergen introduction, kind of the importance of it and the how-tos of it. We'll go over some key nutrition to include, as well as foods to avoid and when and how, and then some common concerns. And this is super casual. So for those joining us, feel free to interrupt us along the way. And Dr. Marissa and I are just going to kind of like bounce back and forth and have this be hopefully more of a conversation and less of a presentation. All right. And then, of course, this is kind of general information. We tend to use the corrected gestational age if you have a premature baby. Those with more complicated medical needs might require a different plan. So always best to talk with your own pediatrician before starting anything. But this is some great general guidance that will hopefully be helpful. All right, so the general gist of when to start. So we typically recommend somewhere between 4 to 6 months. Marissa, I don't know about you, but I typically say if the baby is breastfed, I tend to like to wait till closer to 6 months, unless there's a concern for allergies, in which case, kind of better to take advantage of starting earlier, closer to 4 months. And then it kind of depends on if you're planning on doing the purees or baby-led weaning, which we'll get into later. Definitely, if we're doing more the baby-led weaning part, we want the baby to be able to sit up unassisted. Little bit less important with purees, but still helpful for them to be able to sit on their own. So like not just propped up in a bumbo seat or in a carrier or something. And then we also would like to have that tongue thrust reflex where they're just constantly sticking their tongue out to be gone or going away so they're not constantly pushing out the food that is being put into their mouths. Do you agree, Marissa? Do you kind of have the same sort of recommendation?
Yes, absolutely. I feel like when I finished residency, 12 plus years ago, that the trend was more to start solids towards 4 months, and now I do feel like the general trend is more towards 6 months. But and obviously we'll get into allergies, but early allergy introduction is a big determining factor as well. So yeah, I agree
Yeah.
with what you said there.
Yeah.
Yeah.
And the reason I say to wait to 6 months otherwise is, especially if the baby's breastfed, that has great nutritional content for
Mhm.
them. And so we don't want any foods to ever be getting in the way of that. And we don't want to interrupt that breastfeeding relationship. 4 to 6 months for some moms is also when they're going back to work. And so there's a lot going on. So as long as baby's growing well, I usually say wait till 6 months, but as early as 4 months. I almost never would recommend any sooner than 4 months. They just really aren't
Absolutely.
developmentally ready yet.
Yeah, and these foods aren't a huge part of their nutrition. It's more to learn like taste, textures, how to eat off a spoon, things like that. So
Yeah.
yeah.
All right. So breast milk or formula, whichever baby is taking, or the combination of the two, should be the baby's primary source of nutrition until they turn a year old. So there's an old saying like food before one is just for fun, which nutritionally, I think it is fairly accurate, but it's also for, like Marissa said, learning about different textures and tastes and learning the coordination of eating and things like that, and also introducing those allergies and reducing the risk of food allergies later on. So I usually recommend offering the breast or bottle, so offering some sort of like milk or formula that they're taking 15 to 30 minutes before offering solid so that we're allowing the baby's tummy to fill up with that milk that's supposed to be their main source of nutrition before we could possibly fill it up with the other things that might take its place. Another cute baby, and I put a Zest bib on it.
That's actually her birthday today. It's my niece. She's 2 today.
No way.
Yeah.
I love it. I love it. I love it. All right, so the supplies that you'll need. Most families will want some sort of high chair. I actually don't love this high chair because it doesn't have a place for the baby's feet to rest. So in hindsight, I wish I'd picked a different photo, but I liked the background. But a high chair that has, the straps to buckle in so the baby's not at risk for falling out, supports the baby and has that place to rest their feet is helpful. If it has a fabric cushion or not, I honestly don't really care. When you're picking out a high chair, if you haven't already, find something that you can wipe down easily because these things are going to get janky with
Mm.
all of the foods. Um, Bowls and spoons are another one. I don't know, Marissa, if you wanted to talk about some of the different materials and stuff.
Yes, I think we're both kind of big on this stuff. So,
Yeah.
it's hard to know exactly what risks are associated with plastics and chemicals and materials and things like that. But it's easy enough to avoid. So, my general recommendation is to stick with stainless steel and or silicone. Just because there is concern for, even if there's no BPA, there could be BPS, there could be other chemicals utilized in the plastic materials. And this is something that's going in your baby's mouth that they're ingesting regularly. And so it'd be on the safe side of the safer materials. In my opinion, I believe in your opinion, Dr. Hellstern, are silicone, and I know you especially love stainless steel.
Yeah. Though at this age, I mean, babies will throw literally everything and turn everything into a drum, which is cute, and they're baby scientists, and but they do make the silicone like mats and trays that can kind of stick to the plastic tops
Mhm.
of the high chair, and those can be really helpful, though usually by 7 to 8 months they're figuring out how to throw those onto the ground too. So bibs, it's not required, but it's helpful, protects those clothes, and you'll figure out along the way which foods tend to stain more than others. Blackberries and avocados were the bane of my existence, though I loved the nutrition my kids were getting from them. Um, as I learned and pivoted, I just stripped my kids down naked and just let them eat that
Yes.
way. And then yeah, I would use a little bib, but it was more to save seconds. It was to save the food to then give back to them because most of it ended up in the bib pocket, and then I would put that back on the table
Yes.
in front of them.
And our Zest bibs have a nice pocket.
They do. And then cups. Marissa, do you want to talk about cups a little bit?
Absolutely. So around 6 months of age, it's safe to introduce some water, and really just water. Babies never need juice. I mean, occasionally we use it as a medicine if they're constipated, but really just water. And so introducing that sippy cup or open cup or both is really important to get them to learn the action. They don't need any certain amount of water, but it is important to learn so that as close to one as possible, we can ditch our bottles and be using all cups. Again, same thing with materials. I have silicone options. I have stainless steel options. I always show different varieties that I like to my families. I don't necessarily endorse any certain brand, but I have my favorites that I'll show my families. But that's kind of the idea behind that. So around 6 months, you do want to introduce that. More to learn. Plus, it doesn't hurt to have extra hydration, especially in the summer when it is hot out.
Absolutely. And I think a lot of families will ask me like the kind of cup, right? Like not
Mhm.
even just the brand, but like straw cup or this sort of sipper, or that sort of sipper. I think in general, there's been a push to move away from the hard spouted sippy cups
Mhm.
because those can really impact the way that kiddos are sucking and drinking and also their dentition and things like that. So more the softer sippy cups if we're going that way. Straw cups can be great, but you want to be really, really careful with those like stainless steel straws because those can hurt their palate if they jam them in. So at this age I'd probably avoid that. They do make the silicone straw cups. I'm a huge fan of open cups. They make little silicone
Mhm.
like shot glass sized open cups that I
Yes.
think are really, really great for babies learning how to drink from an open cup. It's a great skill, and they're just small amounts, so when they inevitably spill, it's not a huge cleanup.
Hmm.
And then some optional things to consider, a floor mat, especially if you have carpeting. When my husband and I had our first kiddo, we were living in an apartment with carpet. We literally just bought a few plastic shower curtain liners and laid those down underneath. They were like $2
Oh,
a
that's
piece or
smart.
something, and we would just like wrap them up and put them away if they got too disgusting. But you figure out whatever works for you. Um, and then let me put this on. I'm not sure this is in the way for you guys or not, but materials for making your own purees if you're going the puree route. So some sort of blender or chopper upper. Um, Ice cube trays can be really helpful in pouring that blenderized stuff in and making little portion sizes, and then some sort of storage container with lids. Again, if it's something that's important to you, being considerate of the kind of materials that you're using. I'm a huge fan of the glass Tupperware sort of stuff.
Mom guilt is real, so if you cannot make your own purees, do not worry. It will be fine.
Not one bit. Not one bit. I actually never made a puree in my life. I
Good.
made a smoothie with ice cream. I don't know if that counts.
Well, priorities, priorities.
So, on this vein, purees versus baby-led weaning. So, on the puree side on the left, with these, we can typically start a little bit earlier. There's less of a chance of, hearing those gagging sounds or a risk of choking. And in general, it can be a little quicker to prepare, especially if you're using those like pre-made purees that you get out of a little bowl or pouch or whatever that you buy at the store. With baby-led weaning, babies really need to be able to sit unassisted. I usually say, have them be able to sit for at least 60 seconds on their own outside of any sort of chair or anything, just on a floor. And that tells me that they have enough trunk and like kind of center control and support to be able to eat. A great pro of baby-led weaning is you get to expose your baby to a variety of flavors and textures, and the baby's eating what the family eats. So, when I'm sitting down for dinner, I'm not just having, mashed sweet potatoes. I'm having a meat and a veggie and a this and a that, on a good day, when it's not like Chick-fil-A or Chipotle. But we're exposing the baby to the different flavors and textures and varieties that the family is eating. Are there any other things that you typically counsel your families on, Marissa?
Yeah, I think it's more like, obviously baby-led weaning says in and of itself, the baby's, kind of guiding themselves, feeding themselves, and deciding, when to stop versus with purees, it's parent-led. So you're giving them the spoon for the most part early on,
Yeah.
and kind of, monitoring how much they eat. Obviously, they will stop eventually, but, baby-led is just that. It's purely the baby's in control.
Yeah. So let's go into a little bit more detail. So this is one depicting more of the purees, parent-led weaning, where the parent is controlling the spoon. I just look at the gummy smile.
Who could be more excited than that baby?
You can see those little bottom teeth coming through. Oh my God. Reasons we're pediatricians.
Yes.
So with purees, they can be store-bought or homemade. Typically, the parent spoon feeds the baby, though you could turn the puree into a baby-led weaning kind of gig, kind of a mix match, and have the baby control the spoon and bring it to their mouths. And the jars typically come in different stages based on the baby's age. They usually start kind of watery and soupy and simple, and then they work their way up with the baby's developmental stage to more chunky whole foods. Another cute baby doing more of a baby-led weaning gig where they're just using their hands and eating whatever their family's eating. Again, we talked about some signs of readiness, able to bring something to their mouths. Usually by the 6-month point, they're bringing toys or whatever you don't, a pacifier that's been on the ground or something dangerous that you realize is in the ground to their mouth. There's a great sign that they're ready. Also, if they're sitting at the table with you, even before babies are eating, I encourage the family to have family meal times and bring the baby to dinner with them. If they're looking intently at you while you're eating and opening their mouths or reaching for your food, that's also a great sign. So again, some potential benefits on the baby-led weaning side is we're kind of involving the baby in the whole process of what we're eating. Same food for everyone. So in that sense, it's a little bit easier to prepare. So you've already prepared the food. Now you just need to make sure that you're appropriately portioning it and cutting it up for the baby in the right ways. And we can go into that a little bit later. One of my favorite kind of benefits of baby-led weaning that Marissa alluded to is that babies learn to self-regulate their intake. If we think about the typical American who feels full and then they eat another like portion or two more than that, right? Babies are really great at stopping when their tummies tell them to stop. And so, we're not accidentally teaching them to overeat. We're just letting them follow their lead. And this is another reason why it's important to give that breast milk or formula first, and then let them play around with the foods and learn and explore second. Any other thoughts on this
I
part?
think that that last point there is really important too, and it goes along with age. When we start thinking about starting solids, we think about how soon, but there's also a problem with waiting until too late.
Mhm.
And some babies that aren't exposed to tastes and textures then will develop some feeding problems later on and not really want to eat. So there is such a thing as waiting too long as well.
Yeah.
But in general, that's another benefit of baby-led weaning. Those different exposing those different tastes and textures leads to less of that selective eating, or as people will refer to, picky eating down the line. So it is important to not wait too long and to really expose babies to different taste textures whenever they're ready.
And there are apps to help, and a lot of them, do have a fee that you pay for them. But one of my favorites is the Solid Starts app. They also have a Facebook group that you can join, and they're often posting all sorts of information. And I can show you a few more things from them that I just found this morning, hydrating foods for babies and toddlers and how to appropriately size them based on the age. In
Mhm.
general, our goal, if we are going the baby-led weaning route, is, we want the baby to explore different foods, but we don't want them to choke. And babies' airways are like the size of your pinky finger. So they're small. So small, round things are the most dangerous for them when it comes to choking. So in the very beginning, we give large pieces that they can lick and gum and explore. As they get older and start developing that pincer grasp, that's when we go to the really, really tiny little pieces of foods. And then as they get older, we can start increasing the size again. But when you're very first introducing foods, think of something that they can hold or squeeze in their hands that is bigger than the size of one of your fingers, so that it's so big that it can't block their airway. Does that make sense?
That's what I love about the apps, is that it really does show you the appropriate way to prepare the foods by age so that it's safe.
Absolutely. Absolutely. All right. So this is an example of kind of maybe for like a 9-month-old to 12-month-old where they're, a little on the smaller side. You can see those grapes are quartered. I actually choked on a grape when I was a little one, a whole grape, and my mom had to back thrust me. So
Oh my
thanks to her
gosh.
for saving my life. And I won't disclose how old I am, but my mom still does cut my grapes, even though I am a pediatrician and a mom.
Yeah, my daughter's 7, and I still hesitate to give her a full grape.
Absolutely. Another thing to keep in mind is, even like the blackberries, raspberries, and blueberries. I see a lot of parents, cutting the grapes, but forgetting to cut the blueberries. So either cutting blueberries or just smushing them down is really important because blueberries are a huge choking hazard as well. So how often to give solids? Guys, I have a quick question. So like when I have my Zoom thing with that shows like all the different people, for me, it's blocking part of the screen. Is it blocking yours? No.
Mhm.
Okay, perfect. So if I move it around, it's not going to bother you guys.
No.
So, how often to give solids? In the very beginning, I think 1 to 2 times per day, having like a set time. We're all kind of getting used to eating, right? And getting used to the concept as a parent of like, oh, I need to remember to feed the baby the food. Um, as they get older and closer to a year, I tend to think of it more as like when I'm eating, the baby is eating. But still, up until they're a year old, keeping in mind that the primary source of nutrition should be breast milk or formula. All right, this is one of my favorite topics ever is allergen introduction. And there's a lot of really, really great research out there that's come out in the last, 10 years or so about introducing allergens, because back when we were all kids, our parents were basically told to avoid peanuts and things like that, like the plague, and give
Yeah.
them to us later on in life, right?
Even strawberries, I feel like when I first started residency, a lot of parents were like, "Oh, I was told they can't have strawberries till they're 1." And I was like, "Oh, no, that's not the case."
Mhm.
Yeah, so it does sound counterintuitive introducing allergens sooner than later, but it's definitely what the research shows is most helpful.
Yeah. So just like we were saying, research has actually shown that early allergen introduction reduces the risk of food allergies. So it's actually protective against a child developing food allergies if it's done correctly. And so we're going to talk a little bit about what those allergens are and how we can actually introduce them correctly. So I think the number one place to start is peanuts. And with peanuts, in terms of a safe way to introduce them, whether you're doing baby-led weaning or purees, smooth peanut butter, and giving 1 to 2 teaspoons of smooth peanut butter, kind of like watered down so it's not like a huge sticky glob. So water it down with breast milk or formula or like a rice cereal or something like that. And a key part of this is to continue to offer it 3 to 4 times per week. So just giving it once when the baby's 4 months old, I mean, that's great, but that's not going to do anything. You need the continual exposure to the allergen for it to have its protective effect. So once you introduce peanuts or peanut butter and the baby's tolerated it a few times, you can't just stop. You have to keep giving it.
There's
Um,
different ways to introduce it too. So,
yeah.
I don't know if you've done any allergy introduction. I have had some parents that were nervous about it
Mhm.
because of family history or just because. Then I've
Yeah.
done it, in my office and or at their home and observe the child, which is not a
Mhm.
bad gig to give a baby some peanuts and then play with them for an hour and nothing happens and it's
Yeah.
all good.
Yeah.
So I love it. But yeah, I had a mom just bring me a packet of peanut butter, packet of breast milk. We went like this for lack of, a
Yeah.
kitchen, mixed it together in one baggie and fed it. He loved it. It was great. But there's different ways to introduce it too. So I know in all the allergy studies, they use the bamboo puffs, which are like cheese
Mhm.
puffs, but peanut protein and pureed those. There's the little mix-ins, which you can are actually powders that comes with actually a regimen to follow. And so I have a lot of families that really like that, especially when you're introducing very early. It's convenient to be able to just mix it in and have them drink it as well. So
I
just
actually heard from an allergist that they don't love those as much because they don't, at least from one of my friends who's a pediatric allergist, they don't have enough allergen to actually
oh,
like do
well,
it.
they have, like, a step up. I have a baby who, has very big, family history of allergies, and that's what the allergist had him do.
Oh, cool.
Starting
Maybe
at
it's a
4
different
months,
brand
we
or something.
introduced yeah, we introduced it at 4 months. It says you can't mix it in breast milk, but I have had parents do it, and it was fine, but for what it's worth, it says you they always say you can stuff doesn't mix well in breast milk. But, yeah,
Yeah.
but he did really well, and so he's over 1 now, and he's doing really well. So we did the little mix-ins. Some of them have milk in them, so with babies with a milk protein tolerance, that's something to think about, but
Oh, good.
yeah,
Yeah.
no, I don't know, they come with a plan, so it's a stepwise increase and how to maintain, so
Yeah.
I'll have to look
Um,
into that, but yeah, the allergist knew he was doing that because he
oh,
had a
oh,
big
that's
family
great.
history of
It's
basically
possible that there are just
eczema.
so many different brands of it, and like
Yeah.
maybe there are some like really, really good ones, and you just have to be careful about what you're using.
Yeah, oh yeah, we researched, pretty well, just organic and
Oh, I'm
milk-free,
sure you did.
and yeah.
Another way to introduce peanut butter is, you can also, or to give it is, smear it on things. So you can, smear it on a chunk of banana or something like that.
Melted on
And
toast
then,
is nice.
oh yeah, yeah, yeah. And then something that I did with my daughter, we were a low risk family in terms of, nobody really had eczema or history of allergies or anything. I just bought an organic mixed nut butter that was smooth and that had peanuts,
Hmm,
almonds, cashews, and something else. I think I also bought some Nutella to introduce hazelnut. Of course, that was her favorite. But I just gave some mixed nut butter multiple times and she didn't react to any of them. I continued to give it to her, and that way I was covering all of my bases and didn't have to worry about doing all of the separate
yeah.
nuts. If
I
she
guess then if you do react though, you're wondering like, well, which one is it? But for the most
then
part, I
you
feel
peel
like
back.
there can be cross contamination, so you'd probably be avoiding both tree nuts and peanuts anyway.
Mhm. So that was kind of an easier way for me to do it and maybe a little bit more cost effective because you just buy one thing and keep it in mind to give it a couple times per week. Eggs are another one. Again, keeping in mind developmentally appropriate servings. So, I often recommend, cooking up an omelet or something and cutting it into strips that a baby can grip. And giving this again, 3 to 4 times per week. We want to continue to offer and expose baby to these things. In terms of milk, what we're really thinking about is dairy here. So again, an otherwise healthy baby who doesn't already have some sort of milk protein intolerance or dairy issue, yogurt, cheese, things like that. I am a big fan of cottage cheese and the like unflavored plain high fat Greek yogurts have some good healthy fats and a lot of protein in them. Um, we just don't want you to give cow's milk until the baby's 12 months or older. Too much cow's milk can irritate their bellies and cause some bleeding and can lead to anemia and things like that in the much younger babies. Do you typically say the same sorts of things too, Marissa? Did I lose you? Shucks. Okay. Well, I'm going to keep going and hopefully Marissa will be able to get back. Alexis, can you still hear me?
Yes, ma'am.
Yes. Okay. So it sounds like Marissa's lost, not me. Okay. Um, so for allergy testing, a lot of families will ask like, oh, should we do some sort of allergy test before we introduce foods? And the answer really is no. If there's a strong family history of allergies, then it might be helpful to see an allergist prior to introduction of some of these higher allergenic foods. But otherwise, if you talk to all the allergists and look at like the American Academy of Allergy Immunology, routine testing is not recommended unless your kid is showing signs of allergies. And a lot of times those skin pricks and the food allergy, even like the blood tests, can have some false positives. So we just have to be careful about that. All right, so key nutrition that babies need. So some big things to keep in mind are vitamin D, iron, and healthy fats. Vitamin D, if your baby is exclusively or mostly breastfed, hopefully you're already giving some sort of vitamin D supplementation. It's usually 400 international units a day, or like one little drop or 1 milliliter, depending on what you're giving. Vitamin D is also found in a lot of those like, milks, cheeses, yogurts, things like that. Iron is another one, especially in breastfed babies. A lot of formula is iron fortified, but breast milk isn't. And so trying to work in some of those leafy greens and the beans and the meats and things like that can be helpful. And then healthy fats. So, finding that in your avocados and your seeds and that sort of thing. When it comes to water, we talked about this a little bit, but start with small sips at around 6 months. Babies get their hydration from breast milk or formula. So the water isn't necessary, but it's great to start that developmental process early. So, you can give up to 4 ounces a day or so for the 6 to 9 month olds, a little bit more than that up to a year. And then after a year, that's going to be when babies should start actually drinking water. So after that 12-month point, we're kind of weaning the breast milk, weaning the formula, starting more of the water. Though, just to be clear, you do not have to wean from breast milk at a year. The American Academy of Pediatrics actually recommends continuing to breastfeed for at least 2 years or longer, depending on family's preference. With formula, however, we usually recommend stopping the formula at around 12 months and switching to cow's milk or something like that. Foods to avoid. Okay, so first one is honey. No honey until a baby is 12 months old. Now, there's nothing magical that happens the very day the baby turns a year old, but in general, honey can contain botulism spores, and young infants' bellies aren't able to break down and digest those botulism spores, and so those can lead to botulism. In older babies that are older than 12 months old and kids and adults, we are able to process those and not get botulism if those spores are present. So nothing with honey until 12 months old. We want to limit the added salts and added sugars as much as possible. Just like Marissa was saying in general, right? Like breast milk, formula, water. Babies really don't need to drink anything else. They don't need to drink juice. That's really just, fruit that you've taken away a lot of the good nutritional parts from, including the fiber. At that point, it's really just sugar water. There's really no need for it unless the baby's constipated. And then, of course, avoiding choking hazard foods. So whole nuts, grapes, hot dogs, hard candy, popcorn, hard or raw produce. This is a picture of, this is an x-ray of a baby's neck. And you can see, so just to orient, so here's the skull, here's the back of the head and the mouth or front of the head. This is the vertebrae, or kind of like the neck part of the spine. And in here, this is the baby's airway. So this is where kind of the airway starts from the nose and mouth and works its way down into like the epiglottis area of the throat and then down into the trachea. And you can see this grape here is lodged perfectly and is blocking the air movement, which is really, really scary. So some common concerns. We are here to help. Your pediatrician is here to help. I hear a lot of concerns about choking and poops and arsenic and lead and fruits before veggies. Let's go over them a little bit. So with choking, it's important to understand the difference between gagging and choking. So a lot of babies will gag. Not a lot of babies will choke, especially when you're introducing foods in the right way. Gagging is a protective reflex. It helps prevent choking. It's the baby's way of getting things out before they get lodged in. And it's often triggered when babies start solids. There's this gag reflex. It's a good thing. When a baby's gagging, their tongue might thrust forward, their face might kind of go red, they might sputter, cough, and go, ah. But if they're making sound, that means their airway is not blocked, kind of by definition. If a baby's gagging, let them work on getting it out themselves. Don't sweep your finger back in there because that could push food further and actually make them choke. Let them figure it out on their own. Now, if the baby's actually choking, they'll probably be quiet or even silent. Their face, especially their lips, might turn purple or blue. And if you're noticing that they don't have an effective cough and they're not able to get it out or they're not coughing at all, call for help and start the baby choking sequence and try to dislodge the object. This is where I think it's really helpful for parents and caregivers or family members who are going to be feeding babies to get CPR certified. So you learn how to do the back thrusts and things like that in order to help relieve choking if it's to happen. Pooping, a lot of times when babies start solids, their poops will change. They'll go from those kind of like yellow, seedy kind of stools, the liquidy stuff, because liquid's going in, they'll start becoming more solid. And sometimes you'll see whole pieces of food of whatever you've given in the baby's poops. They often start stinking more. Touch base with your pediatrician if babies' poops are starting to get so hard that they're really straining or groaning or grunting, especially if you start noticing that there are little streaks of blood on the poop. That's a sign that the poops are too hard. If they look like pellets or like rocks. In general, I say the pea foods help for poop. So peaches, pears, plums, and prunes are great. That's usually my first line of defense against constipation. And if that's not working, then you can talk to your pediatrician about other poop softeners and stuff like that. Arsenic and lead, I've heard a lot of concerns about that, especially the arsenic in the rice cereals. I think rice cereals are great and they have, their own place in the world. Just trying to limit and not give only rice cereal over and over and over again. Try to, just kind of give a well balanced and varied diet. And then fruits before veggies. I get this question a lot. If we give fruits first, are they, developing a sweet tooth? To me, it doesn't really matter. Not sure if Dr. Marissa has thoughts, but she's having some trouble, I think, reconnecting. But in general, I think, do whatever feels right for you.